Hi, hello, welcome back. So today we will be seeing about evaluation and management frequently asked interview question in medical coding for medical coders. Okay, so hereby I have added a list of questions which I came to know like they are frequently asking. So here are those questions. First question is, which element of HPI met in the statement? Patient complains of headache and blurry vision for past 3 days. So the location is head and the quality is blurry, and third duration is 3 days. So the answer is location, quality and duration. So the second question is, a physician admit a patient to the hospital. They are there for 5 days, and the physician sees them each day. Which subcategory of code used for days 2, 3 and 4? That is subsequent hospital care. So the third question is, if the pain is sharp, stabbing or dull, what is a component of HPI? That is quality, which is describing the type of pain. Next, the fourth question is, where are the clinical examples for ENM codes found in the CPT code book? Usually the clinical examples of ENM codes are found in the appendix C. Next, we will move on to the fifth question. So the fifth question is, here the patient is coming to the cardiologist for initial visit at a request of his PCP to treat CHF, and the cardiologist examine the patient and discuss the treatment option and schedule the patient for stress test. He provide a detailed report to the patient PCP. Here the code is selected from new patient office visit. Next, sixth question, according to CPT guideline, what is the first step in selecting ENM code? The first step is we have to select the category or subcategories. Category includes whether what type of visit, office visit, in a type of service, and subcategory includes whether he is a new patient or he is a established patient. What category of code should be used to report ENM service provided to patient in a psychiatric residential treatment center? Usually for psychiatric residential treatment center, we will code it from nursing facility service, because it is a kind of nursing facility in terms of the type of care provided. The next question is, a patient is fishing and getting headache. He goes to the local hospital ED and evaluated by the ED physician. What subsection? Here also we will be coding it for nursing facility center. What modifier would be used to report an ENM service mandated by a court order? So here the modifier 32 will be used, because modifier 32 is to report evaluation and management by a court order. We have to report 32. What are the 7 components of ENM service? History, examination, medical decision making, counseling, coordination of care, nature of presenting problems and time. Here the history, examination, medical decision making is considered as a key component, and other 4 are considered as contributory component. So again, what are the 3 key components of ENM service? That is history, examination and medical decision making. Next question is, the evaluation and management service in CPT guideline outline 6 steps to determine the code. First one is select category or subcategory. Second, review the level of ENM service. Third, determine the level of history. Fourth, level of examination. Third, determine the level of decision making, and finally select the appropriate code. 13th question, the first step to determine level of ENM service is to determine the category of subcategory. How do you do that? ENM codes are divided into category representing the type of service, such as office visit, emergency, nursing facility. Some categories are divided into further subcategory. Okay, that is new patient or outpatient, etc. What is a new patient? A patient is new if he or she has not received any face-to-face professional service from the physician the exact same specialty within the group within the last 3 years. Then the patient is considered to be as new patient. What is an established patient? Patient has been seen in the last 3 years by the same physician or qualified healthcare professional in the exact same specialty or subspecialty. Next comes the 16th question. What is an concurrent care? The provision of similar service, example hospital visit, to the same patient by more than one physician or other qualified healthcare professional on the same day. When concurrent care is provided, no special reporting is required. That is called as concurrent care. What is observation status? When a patient has a condition needing to be monitored or determine a course of action. Example, patient presents to the ED with concussion. Provider admit in the observation status. After monitoring, the patient may be discharged if there is no worsening of condition. That is called as observation status. Next, what are the components of history of present illness? First one is location, second is quality, third is severity, fourth duration, fifth timing, sixth context, seventh is modifying factor, eighth is associated signs and symptoms. Location means in the place where it is occurring. Quality means the definition is given, you can go through it. Level of E&M service referred as to a level 1, 2, 3 etc. depending on the last number of the code referred in this category. So each of the key component, level of history, level of exam, level of MDM are further broken down into further division: history, exam and medical decision making. What is the difference between brief and extended HPI? Brief will be documented to 1 to 3 elements of HPI, while extended documents more than 4 elements of HPI. Next will be question number 21. Question 21. What are the 3 types of ROS and how they are counted? 3 types of ROS are problem pertinent, extended and complete. So problem pertinent in the sense review of directly related to the problem, and extended means the system directly affect and related systems are reviewed. 2 to 9 system. Complete means all the 10 systems will be reviewed. What are the 5 types of presenting problems? Minimal, self-limited or minor, low severity. In minimal, a problem that doesn't require the presence of a physician. Self-limited, does not permanently after health status and with good management. And low severity, risk of morbidity with treatment is required. And fourth one is moderate severity, risk of morbidity without treatment is moderate, uncertain prognosis or increased probability of prolonged functional impairment. High severity, also like transplantation, cancer, all these things will be occurring in the high this thing. Okay, so thank you so much for watching my video. Please go through all the questions patiently and understand, write a note and keep, so that it will be really helpful for you to clear your interviews. Thank you so much. We have E&M part 1, part 2 and part 3 interview questions. You can go through it. Thank you. Take care. Bye-bye.